Hi, my name is Maya Waldrep. I'm a second-year physical therapy student at Regis University, applying for my third clinical rotation in the fall of 2025. I was born and raised in Hawaii and attended the University of Hawaii, graduating with my bachelor's in psychology. From a young age, I was always interested in healthcare, but primarily psychology. I thoroughly enjoyed my neuroscience courses in undergrad, and after graduation, I interned with a neuropsychologist. While this confirmed my passion for healthcare, I craved more patient interaction, rehabilitation, and movement throughout the day. I quickly realized that this wasn't the best fit for me, and then shortly after, I shadowed a physical therapist for a few months and fell in love with the field, especially seeing physical therapists help their patients through the recovery process and improve their quality of life. My interests span a broad range of settings, including neurological, cardiopulmonary, orthopedics, pelvic floor, and pediatric PT. My courses at Regis have prepared me well in these fields, and I am performing well in my courses. Regis gives us the opportunity to work with real patients in lab, and this confirmed my interest in working inpatient. At the moment, I am a part of a faculty-led research group, and we are writing a systematic review on neuropathic pain and spinal cord injury. This has continued to spark my interest in the neurological population, and I'm really excited to gain more experience working with these conditions. My first clinical experience was an amazing outpatient orthopedic clinic in Longmont, where I worked with workers' compensation patients. I enjoyed the social aspect of this clinical, and I helped a wide variety of people. I really had a fun time helping and bonding with the patients, and the therapeutic alliance I developed with them made it really hard for me to leave, and I'll always be grateful for the opportunity to practice my knowledge in the field and help other people with what I've learned as a student. I think that's the best part. In fact, this clinical sparked my interest in manual skills, and I am interested in obtaining orthopedic or manual certification after graduation. I've always welcomed and valued constructive feedback from my peers and my colleagues. I know that this is the best way for me to learn and grow as a person, and as well as a working professional for my patients. In CE1, my clinical instructor would often ask me how the session went, so he would let me lead the session on my own, and then he would ask me, how did it go, what are some strengths, and what are some areas of growth for you? And then I really enjoyed this reflective practice post-treatment, and I also enjoyed hearing his feedback as well. Oftentimes it was the same thing that I would say, and it was really nice to get that confirmation. I think that my open mindset and positivity create a supportive and fun learning environment, and I think that this is one of my strengths that I bring to the table. Prior to beginning my third clinical this fall, I will brush up on all of my examination skills and interventions for different neurological populations. I want to be ready to maximize my time by learning as much as I can from my instructors and also my patients. After graduation, I am interested in possibly working in an outpatient-inpatient mixed setting to further develop my entry-level skills in these respective fields. I want to keep my knowledge fresh to provide the best care for my patients, and I feel that I will thrive in both settings as I'm a friendly and social person who enjoys working with new people. I'm so excited to be practicing as a physical therapist soon, and I know that I will make a great addition to your team. Thank you for listening and considering me as an applicant. I hope to hear from you soon.